Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. On today's episode, I'm going to be sharing how the care we provide at Radiant Clinic through our restorative reproductive medicine approach is different than what you would experience at your typical OB or primary care office when it comes to evaluation of menstrual cycle or fertility concern. I'm also going to talk about surgical care differences, and then we'll share some numbers as far as fertility success rates of artificial reproductive technologies like IUI and IVF compared to success rates with the restorative reproductive medicine approaches we utilize in our practice. So, as always, let's get started with a story about a past client of mine who we'll call Taylor. Now, she was referred to us by a friend to help with trying to achieve a pregnancy. And prior to being seen at our office, Taylor had been working with her OB doctor and was told that she wasn't going to be able to achieve pregnancy naturally because of her diagnosis of PCOS, or polycystic ovary syndrome. Taylor and her husband had been told that the only way she would get pregnant would be to go through an intrauterine insemination, or IUI procedure. At the time, she wasn't given any other options and thought this was the only way she could get pregnant because that's what her doctor had told her. Now, Taylor ended up going through 15 cycles of IUI. And part of the reason that she continued on that journey was because she did get pregnant one time around cycle 8 or 9, but unfortunately had a miscarriage at 7 weeks. She did end up taking a pause from IUI for a little bit and had another pregnancy spontaneously without IUI, but unfortunately had another miscarriage when she was about 8 weeks along. She was then told by her OB doctor that if she ever wanted to be a mother, her only remaining option was to go through IVF. Now, other than being told that she had PCOS, none of Taylor's underlying hormonal and metabolic issues were being addressed or treated. So even those 2 times that she did get pregnant, she was unable to maintain the pregnancy because her body was still struggling with insulin resistance, some abnormal hormone levels, and an increased amount of stress because of all of those chronic health conditions. So when Taylor came to see us, as is often my approach, we will have her started with getting some charting instruction. We also did a full lab evaluation focusing on addressing the overall health problems, specifically focusing on insulin resistance and treating her particular type of PCOS. We discussed very frequently that we were working towards long-term improvement of her overall health and frequently reviewed her charting to see how that was becoming different as we were working towards more health. Within 6 months of working with us, Taylor was able to spontaneously achieve a pregnancy without the use of IUI or IVF. I monitored and provided progesterone supplementation to keep levels elevated where they should be throughout her entire pregnancy, so we were able to prevent a recurrent miscarriage. Taylor was able to deliver a beautiful full-term baby, ultimately without the use of any artificial reproductive technologies or any of the other interventions she had been told she would need in order to become a mother. When it came time for Taylor wanting to have a second baby, we continued on the same healthy journey, and she was again able to spontaneously achieve a pregnancy without requiring any of the interventions that she had previously been told would be her only path to motherhood. So let's talk a little bit about what a typical evaluation would look like by your obstetrician or your primary care provider. Now, you may be going to see them because you are dealing with irregular menstrual cycles, or maybe you have been dealing with fertility problems and haven't been able to get pregnant for more than a year, which is typically when they would actually start doing any type of evaluation. When I've requested records from people who have gone through some sort of evaluation in the past, typically we'll see some type of lab work being done. For many people, though, this lab evaluation being done is very limited. So sometimes it will include evaluation for LH, FSH, progesterone, estradiol, a TSH checking for your thyroid function, as well as prolactin. Now, oftentimes these are not timed to the cycle whatsoever. They almost are never timed to ovulation. And sometimes we'll see that they'll have them done on day 21 of their cycle, but sometimes not timed at all. Most of the time, I do also see that an ultrasound has been done, Sometimes women come in and they've had a hysterosalpingogram done to check if their tubes are open, and sometimes a seminal fluid analysis has been done for their partner. Now, what I always like to remind people is that it's not that any of this is wrong, it's just more of an incomplete picture. And so the biggest thing that's missing in most people's evaluation is the timing of your labs. It's incredibly important to know exactly where you're at in your cycle when your labs get drawn. Now, specifically, we're looking at the time after ovulation, about 1 week after ovulation has occurred, because that should be the peak of your progesterone levels. And then we're also checking the levels early on in the follicular phase while you have got that egg that's starting to develop for that cycle. The other piece that is oftentimes missing is that there's often a significant lack in what is evaluated from a lab standpoint. So certainly those 6 that I see typically checked, we definitely want to evaluate those, but again, timed to your cycle. And there's also so much more that we need to evaluate, not only from a hormone standpoint, but from an overall health standpoint. Now, this is not to say that these doctors are negligent or that they're missing the mark. It's just a very different level of training for those of us that work in the world of restorative reproductive medicine. Again, you have to remember what are the tools that we have in order to fix some of those underlying problems. And we actually have quite a lot of things that we can do to look at things from more of a preventative health standpoint, looking at the big picture, rather than just saying, hey, my intention here is to make sure that this person gets pregnant, so therefore I'm going to just jump to IUI or IVF. Now, if you are somebody with certain diagnoses, you're going to be more likely to be referred immediately for either an IUI procedure or in vitro fertilization. We often will see that if your partner has an abnormal sperm count of any criteria, so whether that's he has low counts, low morphology, or low motility, that oftentimes those people will be referred almost immediately for some type of artificial reproductive technology. And again, the thought process here is that there's not enough quality or quantity of sperm in order to make fertilization occur. And what we know is that if we have optimized everything we can from a female standpoint, we can also optimize so much from that male factor standpoint. And that is incredibly important as well. And that's one of the things that we do that's a little bit different, is that even though we are a women's fertility clinic, we do evaluate and assess the different male factor components that may be playing a role. Other diagnoses that are likely to get you a more quick referral for IUI or IVF would be PCOS, so polycystic ovary syndrome, anovulation, so you're not ovulating on a regular basis, long cycles, so my cycles are happening maybe every 2 to 3 months apart, or if you've been trying for more than a year and the initial baseline, that cursory lab evaluation, all comes back normal. Because they don't feel like there's anything else that they know how to do or anything that they can do, oftentimes that's where IUI or IVF is going to jump into the factor. So again, our approach is really different from that standpoint of making sure we've got patients that are charting. We're doing lab draws that are timed to your individual cycle, depending upon where you're at. We are also doing timed ultrasound evaluation, so monitoring that follicle development, making sure that the follicle actually ruptures and releases that egg like it's supposed to at the time of ovulation, as well as including that assessment of the male factor components. Now, when it comes to treatment, that's going to be very specific based on your lab findings, what's going on in your health and your general background and lifestyle. We provide those personalized recommendations and focusing again on that overall improvement of your health and long-term well-being, because this is going to be, first off, what allows your body to achieve a pregnancy more naturally, but secondly is going to create this environment where your body is open to pregnancy, you are able to carry that pregnancy, and we have decreased risk of miscarriage, preterm birth, and the need for subsequent interventions. Now, I want to switch gears a little bit and talk just a minute about surgical evaluation. So surgical evaluation is not something that I personally do, but I do have a network of highly trained surgeons that I will send my patients to if they require additional surgical evaluation. So the very best training that surgeons can receive is in NAPRO technology, which is natural procreative technology. Now, NAPRO has created this fellowship where you can go after you've completed your obstetrics and gynecology residency, and you go through an additional year-long training course where you are working on these meticulous treatments in order to avoid the need for repeat surgeries in the long run. So most often when I'm sending somebody for a surgical evaluation, we're looking for things like any scar tissue. Endometriosis is another big one. Sometimes we'll send women for treatment for polycystic ovary syndrome, depending upon what their symptoms are looking like and what else we've already tried. Now, the biggest difference that we see is that if I send somebody to see a surgeon who is not a naprotechnology trained surgeon, oftentimes if they go in and they take a look and maybe they find 20 different spots of endometriosis, often what will happen in the non-napro surgeon is that they will burn off those lesions called fulguration. And so they're going to burn off those endometriosis lesions. If they see 20 lesions, they might decide, well, I'm going to take the 5 biggest lesions and we'll go from there. The biggest problem with this, first off, is that there's a significantly increased risk of scar tissue because of the way that endometriosis tissue was removed. The second piece here is that we are still leaving behind so much endometriosis, which can cause future problems. And the third thing is that oftentimes these women are being told, okay, go home and get pregnant right away. You have maybe 1 to 2 months. And after that point in time, the inflammation is just going to come back. And then if you decide down the road that you're still having problems or you want to get pregnant again in the future, we'll have you come back again and repeat a procedure. Now, I don't know about you, but most of my patients do not want to go back for any more surgery than they absolutely have to. So the biggest difference with sending somebody to see one of these naprotechnology fellowship-trained surgeons is that if they go in and they find 20 areas of endometriosis, they will go through a meticulous process during that surgery of excising or cutting out each of those areas of endometriosis. They will also make sure that they get all 20 of those endometriosis spots because they don't want to have to come back again down the road. They also are trained in utilizing specialized techniques to avoid scar tissue so that we are minimizing the need for repeat surgeries, we are minimizing pain, and we are significantly improving not only menstrual cycles and fertility rates, but also quality of life for these women. So let's talk a little bit now, shift gears as far as looking at success rates when it comes to comparing something like IUI or IVF to working with somebody who is doing restorative reproductive medicine. Now, I will say there's not any real clear data that looks at overall success rates when it comes to any of these factors. So these numbers today that I'm going to share are just rough estimates. The other piece that's really important to know is that when you're looking at data is going to be very, very different, especially when it comes to IUI or IVF, depending upon the center that you use. And the other incredibly important piece to watch for is to look at making sure you are evaluating the live birth rate versus the pregnancy rate. So many centers will post their pregnancy rate, but this does not include or count out the people that have had a miscarriage or a preterm delivery that resulted in a fetal demise. And so for most people, I recommend asking specifically about what's the live birth rate, because that's really ultimately the end goal, is to deliver a nice, healthy, hopefully full-term baby. So let's just talk some broad average numbers right now. So when it comes to intrauterine insemination or IUI, average cost per cycle is really variable. It can range anywhere from $500 up to $4,000. And that, again, is going to be for one cycle of IUI. Now, the live birth rate per cycle of IUI is 5 to 15%. So that means if I go in and I have one round of IUI, my chance of having a live birth is going to be 5 to 15% per cycle. Now, that does increase over time. And certainly after about 3 to 4 cycles, they say that rate of IUI successful pregnancy and live birth rate goes up to about 20 to 25%. Again, you're going to have that increased and added cost with each cycle, so that does play a role as well. The other important thing to know is that if you are a woman over the age of 40, your chance of a live birth rate per cycle drops significantly down to about only 2 to 5% per cycle. So not great success rates, despite it being something that is incredibly commonly recommended at the obstetrician's office. Let's talk a little bit about IVF. Now, in general, the cost for this can vary widely. A lot of it depends upon if you are utilizing your own eggs, if you are utilizing donor eggs. All of those things can play a role. But on average, nationwide, the cost per cycle of IVF ranges about $20,000. Now, certainly there are some programs that have different grouped and bundled rates and reassurances and guarantees and all of that, but on average, we're talking $20,000 for one cycle of IVF. When we look at the live birth rate per cycle, it is incredibly variable, ranging anywhere from 10 to 50%. And there's obviously very significant differences based upon the lab and the clinic that you are working with. Now, some centers do boast rates of up to 65 to 70% live birth rate overall. However, there is a significant difference depending upon your age when it comes to IVF. So, for example, if you are someone less than 35 years of age, you'll have about 45% success rate. If you are between the ages of 35 to 37, that drops to about 32% success rate. And if you are over the age of 41, that drops to about 3 to 9% success rate. Now, one of the other big things that we pay attention to, especially with IVF, is that it can increase the rates of multiple birth. Now, a lot of studies have been done looking to try and decrease the number of transfers that occur because we want to decrease overall risk for mom and for babies. What we know is that with the increased number of babies that you have within a pregnancy, there is a significant increase in the risk of infant death, cerebral palsy, as well as pregnancy and labor complications. So because of this, many IVF centers have gone to doing just one embryo transfer per round in order to try and minimize some of these concerns. Now, let's talk a little bit, instead of artificial reproductive technologies, let's look at what the success rates are for a full-term pregnancy, live birth, happy mom, happy baby. Now, most of these studies are going to look at when you've been working together for a year. And in some of these cases, it does not take a full year. But what we know is that oftentimes the longer somebody is able to stick to treatment, the more success rate we have. And overall, across the board, what we find is approximately 50 to 65% success rate. And that's, again, going to be live birth rates with pregnancies in women who have previously had any type of infertility diagnosis overall, whether that is male or female factor. Now, when we're talking about these restorative reproductive medicine, there are a couple of different groups or organizations that have done a great job as far as continuing to watch the research and looking at their methods in particular. So I want to talk a little bit again about NAPRO technology, which is what we had talked about with the surgeons that were utilizing that. Now, there's an entire side of just medical NAPRO technology, and I am trained in that method. And so what we find is that it can have significant increased success rates, especially for women with a history of anovulation. What we see is that with those women, they can reach up to 81% of the time having a full-term birth and a successful pregnancy. In women with a diagnosis of PCOS, restorative reproductive medicine with NAPRO technology can approach 62% for live birth rates. And in women with a history of endometriosis, that approaches 56%. Now, again, the other big factor that I didn't even mention here yet is the cost. So when we're looking at restorative reproductive medicine, we are nowhere near approaching this cost of thousands of dollars, right? We're looking at what is the overall underlying problem, correct that health condition, teach you how to chart your cycles, and give you something that you can then use for the rest of your reproductive days, as well as continuing to improve your health overall. The other big body of research that has been done is published by Neofertility, and this is by Dr. Phil Boyle. There was a paper that he'd posted back in 2018 looking specifically at the success rate after women have had failed IVF attempts and an average of 6 years of infertility. So again, these are the women that have already had significant problems. They were not able to achieve success with IVF and have had a significantly prolonged course of infertility. And even in those clients, he still was able to have a live birth rate of around 32%. Now, this paper was published about 6 years ago, and I know from talking with Dr. Boyle that his numbers have continued to get better, even in those very, very hard to treat cases. Overall, his methods with neofertility approach 60% as far as successful pregnancy rates in the long run of working with a couple. So I know these are a lot of numbers to digest. I just want you to be aware of knowing how typical care that you may be receiving may not be the whole story. And I really would just implore you to look and say, hey, There is a different way forward. There is a better way forward that has improved success rates, decreased cost, and is looking at improving my overall health and well-being in the long run. Imagine if you had actual answers to your problems when it comes to not only your fertility, but even to your menstrual cycle concerns. This way forward is possible to get the best outcomes with live births and working together to correct underlying health concerns that also impact your overall well-being. It starts with getting to the root cause with an appropriate diagnosis and individualized treatment plan tailored to improve your health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa or Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.